long embraced boob jobs, facelifts and cosmetic surgery in general, but don't think it's purely an American thing. Good old New Zealand is quickly catching up, and it seems the road to appearance medicine is becoming very well travelled here.
But who's getting what done, and why are men jumping on the bandwagon? We've got a couple of real-life nip-tuck types in with us to tell us more. Mark, Pierre, welcome to the show.
Thanks very much.
What are New Zealand men wanting procedure-wise, Mark?
I guess that they're wanting something that's a little bit less than women. They want something that's a bit less noticeable, certainly. But they just want to slow things down a little bit, halt the progress of time. Guys are no different than women. I mean, you shouldn't have all the fun. I mean, we certainly want to have some,
long-lasting good looks.
Yeah, basically, and it'll catch up with you around your 40s. And there's an area of either prevention. I don't want this to happen, or this has already happened to me and I actually want to get something back. So, you know, guys are looking for things, particularly liposuction, nose jobs, hair transplants, those kind of things are very popular within the surgical field.
So, Mark, you're the chopper. You're the guy that does the invasive stuff with the scalpel.
That's right.
And then, Pierre, you're the more of the Botox kind of guy.
Yes, right. I'm more dedicated to non-invasive procedures. Yes. And, you know, the trend in having non-invasive procedures is certainly growing. And Botox has been dominating the scene. And I do see men being purely jealous of women being always stunning and amazing, and you know, they want to have something done as well. And Botox has, like I said, been dominating the market, but now the increasing interest has been in lipolysis, which is this new technique that involves injectables that melt the fat. And so this has, you know, the Hollywood scene always dominates sort of the trends, and it's been an increasing trend.
So this is opposed to liposuction. You get injected with something that melts away the fat?
Exactly.
Yeah, interesting. How much is that?
It's much cheaper than liposuction.
I had my BMI done yesterday and it was well out of whack. I can't believe it. I'm a 25 BMI, so anyway, I'll talk to you later.
Okay. How preventative is appearance medicine?
Well, it is. I get that sort of question every day. When should I be starting? Am I too young? Well, not really. I mean, prevention is the name of the game in health, and as it is in cosmetic medicine. So it starts from topical skincare, and of course, you know, that's the name of the game, and sunscreens. I mean, in New Zealand, we all know that is the #1 aging factor. As far as Botox, of course, that will prevent the muscles from generating those lines and deep furrows and wrinkles. So that's definitely a preventative medicine. So,
I mean, I can't help but study you two and look for the little lines, maybe the hairline, scalpel.
They're doing the same thing to us.
I know you're dressing me, looking for that. Yeah. There are jobs you won't take on. But anyway, I mean, you both look really healthy. Have you been under the knives yourself? Have you done anything yourself? Nothing at all.
No. It's prevention. Well, I guess people you said it very right. I mean, people want to look healthy. They don't just want to look good. And, you know, we have the technology now to make, you know, slight, small changes that starts with lifestyle changes and then go on with small cosmetic, non-invasive, and in certain instances surgical that make things better.
But answer to your question, I mean, we've had...
an increase in the amount of men coming through?
Yeah.
Absolutely.
We're just looking at pictures on the screen now. This is what's happened here. His chin's been altered, hasn't it?
Chin and a nose.
And his nose.
Oh, and his nose, I see. Yeah. Gee, that's made quite a difference, hasn't it?
Mark, are people scared to go under the knife, or has that...
Yeah. Yeah, I mean, elective surgeries are a worrying prospect, and one of the problems with a lot of this TV stuff is it trivialises the dangerous risk of having elective surgery, and we're always trying to put people... I mean, I'd probably only operate on 1 out of 20 people I see.
Right, OK. So a lot of it's just sort of...
Yeah, and a lot of people, you don't know what you want, and it's so confusing. There's so much stuff out there. So guys come in, and the key really is, I mean, like the guy you've just seen, I mean, a lot of surgery that I do is reconstructive surgery, or actually, you know, someone's nose is altered or their face is altered, and you want to put that, you know, change that back some way. Whereas the cosmetic medicine that we're really talking about here, the surge or the trend is really in the non-invasive stuff, the Botox, the fillers, the lipolysis, all those kind of things.